But just how you've described it gives me also hope in that the face of some of these programs that members, particularly new members, are seeing are not those that maybe get a paycheck from that program, but businesses who've benefited by it, people who've gotten skills and on a good career path, paying good wages, or people whose lives were changed and saved because of this, local elected officials. Mm-hmm. It's that face saying this is an investment we think is in our best interest, not only as a community, but as a nation.
Well, I talked to our CEOs of our local hospitals, and they're the biggest advocates of the health clinics. In fact, most of them are involved financially with them and working on them. That's what's keeping a lot of people out of the emergency rooms that are very high-cost care. But just the City of Lynn's health clinic serves 50% of all the children in the City of Lynn and 1/3 of all the families. Right. So why the North Shore Medical Center is involved with that.
Correct.
Up in Gloucester, like we have the same situation. It just goes right on down the line. So we've got to do some work in making sure people understand that there's a way to strategically go about and systematically look at what needs to be cut out, waste and duplication, things of that nature, but to really keep investing in people on that.
We're at sort of the epicenter of this continuing resolution budget debate as we do this taping. I do have some hope, some degree of optimism that particularly the new members that were elected, particularly the 87 new members that were elected last November, when they go back to their districts, for the first time they're really going to sit and meet different constituencies, whether it's the local elected officials, business people, maybe that they didn't have a chance to meet in the wave of election of 2010. And I think the message they're hearing back in the communities is far different than some of the budget policies that they're voting on.
Well, I know one example of where that worked. I had a lot of the community colleges come in. I'm lucky I'm the only member of New England on the Education Labor Committee, so right. It gives me good involvement with the colleges and universities and community colleges in our area. They came in, they were very upset that the Pell Grants had been impacted so heavily by the proposed so-called continuing resolution. And a couple of the newer members, they were concerned about it, so we go see them and tell them. And they went, and one in particular I'm thinking of, who I won't name or whatever, it hadn't had an appreciation for the economic impact that Pell Grants have when they support a university in your district, and what that means for the community that houses that university, the number of faculty and administration and staff, number of students that get the opportunity to go. And so that person pledged to look at it again and probably change their vote. So you're right, getting those people to speak up, people in the community that know the value of these institutions, it would be important. But if we can, I want to talk one thing, the community development, community service block grant. All right, I'd like to just explore that a little bit because you had a lot to do with setting that up in the beginning. Explain to the folks, if you would, just what is a community service block grant?
Well, it was written in 1981. The War on Poverty, which Lyndon Johnson and the Great Society, Lyndon Johnson as president, Sergeant Shriver as first director of the War on Poverty. It was basically a federal-local relationship. And Ronald Reagan, when he was elected president, similar to situations perhaps currently with the House of Representatives, wanted to scale back government, reorder our priorities. And one of the many programs on the chopping block was this federal-local relationship that funds about 1,100 community action agencies that you mentioned earlier in your district, 99% of the counties. A couple of moderate Republican senators gave me an opportunity to figure out a system in which the federal government, in partnership with states and local communities, could still invest in these agencies. So we developed this program that is a block grant called the Community Services Block Grant that allows the states to fund these agencies, that encourages local strategies, local innovation, local flexibility in the communities, that brings in business, local elected officials, the poor, all involved with decision making, and really rewards a lot of innovative strategies dealing with poverty problems and poverty issues in low-income communities. And it's a small program. It's about $700 million, which is real money, but in the 3.6.
Well, that's spread out through the whole country, though.
Spread out through the whole country. It all told, in 2010, about 20.7 million people visited these agencies for assistance.
Now, I would assume 2010 was an even bigger year than normally. What I hear in my district is that a lot of folks that are taking advantage of it now never considered themselves to be economically marginal at all. But with the economy capsizing in 2007, they reluctantly but eventually realized that it is important for them to reach out and get some assistance. So whether it was trying to stay in their home, or whether they had lost their home and needed a place to go, whether it was food, because our food pantries are extraordinarily busy, getting there, making sure that their kids and their family had the nutrition they need for that, whether it was home heating fuel. All of these go through our local community action programs. And I think one of the impressive things about the program is it's flexible. So whatever that community believes is the need there, they can take care of that issue. And that's, I think, critically important.
Well, it's also flexible, but it is also trusted. In that I tracked some families in Michigan in the height of the recession when General Motors and Ford and Chrysler were laying off. And those families, middle-class families who never once thought they'd need that agency, even knew what the agency up the street did, found themselves turning to an institution that was unknown to them because they were desperate, they needed help, they were either risking foreclosure on their home or they were laid off or whatever. And now all of a sudden, thank heavens, this institution that we never realized was here, we're vaguely aware of it, was there to rescue us when economic circumstances beyond our control impact our lives.
Well, besides all the services that they manage to provide directly, they're just such a great connection to other service things. They can hook people up with a need that they have. In our office, I know the congressional office, our state reps and state senators, our mayors and selectmen and town managers, always getting calls from somebody. We're not equipped to actually provide the service. And in fact, we make a referral time and time again to our different community action groups who in turn either take care of themselves or know exactly where a person can go. So I've always obviously been inundated with John Cuneo from up around our Newburyport area and Amesbury area, our folks at the community action in Gloucester, and Beth Hogan over in the North Shore Community Action, and Jack Mogilnicki in Lynn. And they send in to me just a copy. What happens to those organizations and what people won't be served if they're so radically affected on that? But it was emergency assistance of all sorts, home weatherization, people that were just spewing energy out of their homes because they didn't have the house weatherized on that. It made a difference in their bills that made them able to stay. Youth activities and senior citizen activities, Meals on Wheels, delivering meals there, giving people employment if they need it if they're over 55 but still need to work on that. Transportation issues, everything from getting people to a clinic or a hospital or the needs that they have for shopping. Domestic violence crises, when it really gets to be a crisis on that. Food pantries, emergency sheltering, Head Start program we talked about earlier on that, job training, vocational education, housing. All of these things, there's a place that people have to go to be able to get it done or get a referral to where it can be done. And that's where I think our offices find these agencies so effective.
Well, I agree. There's two things that came to mind. I was driving home late on a Friday night a few weeks ago, and I got a call, which I answered, which I shouldn't have, but no police were around. And it was a bank president from an upper Midwest state, Montana, called me, Friday night, flying to Washington on Saturday because he was so upset that the agency that he'd been on the board for 15 years was threatened going out of existence. And he said, we will survive the town that I'm in. We can handle the loss of this agency. But all the small communities who rely around this particular town that rely on these agencies to coordinate those services, to bring in all the additional resources, etc., they're going to be absolutely helpless. And where are all these people that need these agencies, turn to these agencies, going to go? Can't handle it.